And it looks like we are live. Hi, everyone, and welcome, Nikki. How are you tonight?
Hello, thank you, Steph. Hello, how are you? How is everyone?
I'm super well. I was very excited about tonight's live. Firstly, because I miss you and I haven't seen you in a little while, Nikki.
It's been a while, I know. We've been busy Lizzies.
Oh, we certainly have. And secondly, because we've got such an incredible topic tonight. It's a hot topic. I think it's been a buzz topic for the last couple of years, or even ever since COVID, really. And we're talking about mental health in aesthetics. But before we start, Nikki, please tell everybody watching a little bit about yourself and who you are and your wonderful businesses as well.
Hey, well, Nicky, so business-wise, well, look, my background is I'm a nurse, and I'm very passionate about mental health, always has been. I've been working in mental health for quite a while before I came into the aesthetic space. And in fact, I had an opportunity to get into the aesthetic space. And as soon as I got going in the aesthetic space, I almost very quickly did a U-turn and I went, this is not for me, because there were a lot of alarm bells and a lot of red flags that I identified that didn't sort of sit well with me and my values. And but I was fortunate. There was a great trainer that said, hang on, don't go. Let's line you up with somebody who is quite ethical in their approach to care and service delivery. And so I started working with a doctor who was, a great guy. And I decided to moonlight in the industry. I just wasn't sure how I felt about it. I felt that there was I'll cut to the chase. I'd be in a consultation and I'd actually see vulnerable women coming in seeking, expensive treatments because they were not feeling happy on the inside. And I noticed clinicians very happily taking good money from people that were quite vulnerable. And it didn't sit well with me. I thought there were better ways of approaching and caring for such individuals. Long story short, I thought, well, I'll just do a little bit of, injecting, a little bit of consulting and continue working in that mental health space. I enjoy doing. The long story, I keep saying long story short, but it's a story.
It's not short, is it?
It's a story. It's not
Very
short.
nice.
But what eventuated from that is that through my consultation and assessment process, I pretty quickly, identified that patients were perhaps not being consulted and assessed in the most ethical way. And from that point, I realised there was an opportunity to add value to the way we actually conduct our consultations, our assessments, the way we learn everything and anything that we need to know in regards to aesthetics. And so I wrote a training program with the support of this doctor, and I said, let's give this a go. So we wrote this training program. Back then, it was an ad in Gumtree.
Oh, really?
Gumtree, and we haven't stopped training since.
Oh, yes.
So it's been interesting. It's been such a privilege to be part of that whole process and journey, and with the participants and the learners coming through, and with a wealth of incredible humans coming through to support what we've been doing and what the ethos has been. It's developed into an incredible course. But the fundamental and the foundations of my why and why I wanted to actually develop a training module or education for the aesthetic industry was to include the likes of mental health, consultation and assessment, and to view the person from a holistic perspective, not dismiss the head to toe assessments that we do in mainstream care, because what I did notice early in the piece is everything was very much, okay, let's do the cheeks, let's do the lips, let's do whatever area the person wanted modified and corrected. But there was a disassociation and a disconnect with the entire person. So that's how it all kind of started for us. But the mental health has always been there, and we've done a lot of work around that and continue to do so.
Yeah. And, I can't believe you said Gumtree it started. And now you're one of the biggest, most renowned, most respected, the CPD Institute. This is where I get a lot of my nurses for my clinics. And professionals, all round professionals. Every time I look on the resume and I see CPD Institute, I'm like, well, I know that they've come out with, for starters, you know, when somebody goes in to do a training course that's quite intensive, you know that they're committed for the industry. So they're not really a fly-by-night type of person. They've committed to a really good quality, you know, training institute. But then the quality of education that comes out of there is really second to none. You're a pioneer in the industry. You do so much. You're an innovator. You're a forward thinker. Sometimes it makes people feel uncomfortable, you know, going into spaces where they don't know what it is or they don't know what's happening. And I think this is one of the areas where we all feel a little bit uncomfortable because it's out of our wheelhouse. However, our industry, aesthetics, is very much linked to personal well-being and mental health, right? Because the way that we look on the outside a lot of the times isn't as a reflection of how we feel on the inside and vice versa. And so what you're talking about is such a fundamental issue. And the work you've done is so pioneering. Please give us a background. Tell us, what is BDD? Why is there so much of a focus on it? You know, when did it start?
Yeah, look, I think it all started back in 2017 when my first recollections, when the Medical Board of Australia actually identified, and it was targeted towards plastic surgeons for surgical treatments, that consideration for pre-screening of patients needs to be, it's a discussion, it needs to be had. They said we need to pre-screen patients before we proceed with any invasive treatment. So it was noted that it needed to be considered, but there was no pre-screening tool or support there for any clinician. So that was a trigger for me. And that's when I set off and met with the research team of Swinburne University, psychological department, Dr. Simone Buswell, who's pretty incredible. And we set out to look at conducting some research around BDD and mental health considerations in aesthetic practice. So we actually employed a PhD student to actually support us with some of that research, and we developed some evidence-based tool out of that, and that was the main agenda of that collaboration, so that we actually had an evidence-based pre-screening assessment tool that can be used. Initially, the goal was that we develop this for cosmetic nurses, for the non-surgical space, because that's the space that I was in, yeah, we're very proud. It's an evidence-based program or a survey, focuses on addiction, identifies elements of addiction, anxiety, depressive disorders, and I can take you through it, the tool a little bit later, and it actually just highlights. It's very easy, friendly. We want it to be quite easy to use for both the consumer, I should say the patient, and the practitioner, whereby there's a link, there's a survey that gets completed, and then the clinician actually receives the results, whether that be red, meaning the patient is a high risk, red flags, not suitable for treatment, amber, tread with cautions, there's considerations we need to be thinking about, and the green, of course, being the obvious, good to go, they can proceed with treatment.
So easy. I mean, there are some screening tools out there, very, very manual in nature, having to, you know, add things up and so forth, and a little bit overwhelming. We have looked at a few of them for our clinics, but I can say the CANSAT tool is a unique in the way that it operates and the way that you use it. Is it because you fill out this survey and then all of a sudden you get your result in, you know, real time? It's not a long process between filling out this survey and then receiving the results. Is that true?
It's fairly immediate. The minute the patient actually completes the survey, the results go straight to the clinician. And I think what's important about it is that it's the first evidence-based tool that's actually been developed. And I can go through the benefits of it, is that it supports you in the event of any litigation, okay? So you can actually say that you've had pre-screening of the patient. Now, you know, if the outcome of the pre-screening tool identifies the patient as a green, they're good to go, there's no alarm bells, but things eventuate thereafter. In the court of law, you have some evidence to say, to the best of your ability, with the tools and opportunities available, you have provided the best pre-screening opportunities to ensure that you're providing the best consultation, assessment, and treatment plan for your patients. And that's the best we can do. So it's critical in that, from that perspective.
Yeah, absolutely. And it really helps you as well as a practitioner. I mean, covering yourself legally is very important. You need your assessment tools, you need your consultations, you need to do things by the book. But also when you're faced with patients, it is a struggle sometimes. It's a challenge to know if this person, you need to be treating them in a certain way, or you need to be a little bit careful. Without that tool, without, you just having a conversation just before you going into treatment, you're kind of leaving yourself a little bit exposed. And how many times like I know in my clinics, I've had that many times things go a little bit wrong to match the expectations of that client or that patient. There's a mismatch there without doing your thorough pre-screen. I'd love you to be able to share that tool with us. Can we have a sneak peek?
Yeah, we can, but I just want to elaborate on that. And I think that consultation assessment piece is critical. And by no means am I implying that consultations and assessments are not done well in our industry, but I certainly think that can be done better.
Better.
I actually reflect that upon my own practice. It all depends on how I'm feeling on the day. I can do exceptional consultation and assessment tools, or I can do just what I need to do. So what we need to move from is that tick and flick concept of I've asked the right questions and I've attained, the answers, and I've attained a person's, signature, and I have, legal, I suppose, pathway to be able to proceed with treatment. It's about digging a little bit deeper. And with the CANSAT tool, which I'll take you through, which is something that I really like a lot, is that, yes, there's been a huge focus on BDD, yeah. Dysmorphia is only one element of consideration for us, and it's only for a small percentage of individuals seeking treatments. I think what's even more important is that we focus on the likes of anxiety, depression, perimenopausal women, menopausal women. We're talking about emotions, strong emotions that can alter between one consultation and the next, which then can also affect and change expectations of treatments from, one moment to the next. And I think we need to focus more on these things which are critical, rather than one single thing being BDD and dysmorphia and the risk of. That's there, that's real, but all the other things that come before it, I think, are a lot more important.
I completely agree. I mean, you're dealing with a whole person's psychological profile. They're coming in and they have, you have your baggage, you have your things that are weighing you down, you have health issues, and then you have mental health issues. And body dysmorphic disorder is only one small element, right? And we come across it very sparingly. It's not an everyday thing. But we're dealing with perimenopausal and menopausal women every day. We're dealing with people who have mental health concerns every day, and not necessarily do they need to have body dysmorphic disorder to be able to suffer those feelings as well, and then have them expectations not match what they're wanting, or that deep need to feel better. They're hanging that on the fact that, look, I'm going to get my cheeks, my lips done, or I'm going to get some work done, and then I'm going to feel good about myself. And sometimes that doesn't translate. Also, like, I know when you're saying, like, you're a human being, you have a great day, and then you might have a day where your instincts are a little bit off, right? You're not connecting as much with the patient, and then you miss some cues.
Absolutely.
This tool ensures us that we don't miss those cues.
Absolutely. It supports it. It assists. Absolutely, it can. What I'll do is I'll just share my screen. Have you got that there?
Not yet.
Now?
Coming. Yes. Love it. It's live.
Alrighty. So this basically takes us through. Oh, let's see if I can do this. Here we go. So the benefits of the tool is to help us identify, explore, support, and protect both ourselves and also the end user, which is our patient or our client. So it helps us identify different motivations that the individual might have. Are they intrinsic? Are they extrinsic? So by that, we're actually asking, is the person seeking to have treatments for their own happiness and for their own benefits, or are they enticed or motivated by somebody else's, I suppose, perception and perspective of themselves? It assists us to explore all of those motivations, to look at treatment plans, whether they're realistic what their motivations and what their commitment to the treatment plan will be, which is another really important thing, which has been touched on. We don't cover it, of course, in the CANSAT tool. That's a separate discussion altogether, but that financial, I suppose, motivation and ability is another consideration that ties in with a person's motivation for treatment as well, which we need to unpack. So the CANSAT tool supports us as clinicians to ask questions that we may and probably would not consider asking, as we're not psychologists, we're not social workers, so the tool does all the work for you. In that, it asks all of these questions. They're all evidence-based. They're all taken from metrics from other evidence-based and approved tools. And then we actually have a list of key questions. We've got the back-end algorithms that support in identifying whether a person is actually going to be safe to receive treatment, needs further exploration and consideration, or is unsafe. Now, when we move on to, I'll jump in. So basically what happens is that the clinician will actually provide the end user, which is the patient or the client, a link. Once they receive that link, it takes them straight to the survey. They complete all of the questions and they press submit. The minute they press submit, then the practitioner will receive the results. And the results will pretty much come in as a red, amber, or green. Now, this is the bit that we need to unpack and explore more. So red is quite obvious, as it will indicate high signs of mental health concerns or problems, and that's where you would need to refer to a medical practitioner for further guidance and support. The amber is the one that we need to do a little bit more work in, and this is why I'm passionate about consideration for anxiety and depression and other mental health concerns and problems. Because we have what we consider to be situational concerns or mental health concerns and problems. And that was most evident in the last Australian Bureau of Statistics results, where we saw such a spike and a high of anxiety and depression, which was further emphasised due to the likes of lockdown, COVID, and all of that. So what that tells us is that it's a transient space, this amber bit, where you could have a person coming into the clinic 1 week feeling quite heightened, happy, elate, like in a really great space. Anything can happen within minutes to hours to days, which therefore means that the next time they come in, they're not the same person that they were 24 hours ago. And something that we're not privy to, and I'm really passionate about highlighting, is that we're not privy to one another's internal dialogue. We could be sitting here and nodding and looking like we agree, but we have the ability to multitask. We have the ability to listen, to agree, but to actually have multiple other conversations and thought processes. And this is where we are at potential risk with our patients. So when we see the amber sign come up, that's where we have opportunity to dig a little bit deeper, to ask the likes of, what's been going on in the last 24 hours? Is everything okay at home? Is there anything I need to know? What's changed from the last time that we've last caught up? People, once you open that door and give them permission, and that they will start to share some information with you. I mean, let's face it, they're there sharing their most vulnerable part of their body, which is their face. Things can go terribly wrong. So if they've sort of walked in the door and sat on that bed wanting to receive treatment from you, then we'll assume, and it's a big thing to say, assume there's an element of trust that they have for you, and that can be further extended with the right questions for an elaboration of what might be going on for them. And this is a really great opportunity to extract more information. So when there's an amber, it doesn't necessarily mean that the person is not appropriate to have treatment. It means there's things going on, and we have a duty of care to dig a little deeper and find out what's going on for that person at this particular time. And it means that maybe today is not the best day for them to have treatment. I mean, if some of their answers are, look, going through a separation, there's been a death, or there's illness in the family, I'm not feeling great. It makes us stop and ask the question, well, is today an ethical and an okay day to proceed with treatment? Or should we be looking at less invasive treatments so that we can provide a bit of a cooling off period and allow our patients to perhaps proceed with the treatment that they're going to celebrate at a later time? Yeah. So look, I can talk about this forever, and it's a whole module in itself, but Amber is, I think, a very powerful place to be, and that's where you can really find out more about your patients or your clients. And then green, of course, is obvious. That means that there are very few signs of concerns with regards to mental health problems, and that you could safely proceed on the day with treatment.
Yeah, wonderful. You were talking about, today versus another day with a client and patient. Would you have the patient fill in this assessment every time you treat them?
Look, I'm not sure how well that would go. I think it's designed that you, I think, do proceed with this assessment definitely at the initial phase when they're coming to you for the first time, or even perhaps on an annual basis. Definitely the first time they come in, because that's your baseline. You have some pre-screening and some evidence of a person's mental health well-being when they come to see you.
And then red flags that we should be looking out for. What are they? What should be aware of when we're actually assessing a patient's mental health before we actually proceed with treatment?
Well, let's start with Basics 101. How is the patient or the client walking into the clinic? Are you observing the way they actually walk when they're walking into your room and sitting on the bed? Are you observing the way they are breathing? Is there signs of anxiety? Is there fast-paced breathing? Are they fidgeting? Do they look nervous? So it's all of those basic 101 observations that we need to be doing anyway as part of the initial assessment process. Consultation and assessment, making sure you're on the right page. Are they agreeing to everything? Are they truly understanding the treatments that they're seeking to have and all the possible risks and consequences? Big red flags is when you ask them what their expectations are, what outcomes are they looking to achieve on their visit. Asking them historical questions. How many treatments have you had in the past? Have you been happy? Why have you been to 20 different clinicians? What was it that you weren't happy about each and every one of those treatments? So, you are going to be an investigator, and you need to look out for things like this. So it actually positions you, and this is really important, positions you to ask yourself, do I want to treat this patient? Am I happy to proceed and to give, give them what they're asking for? Am I the right fit? So number one is empowering yourself, I think. And if you can't empower yourself, then you can't empower your patients. So I think that's an important consideration.
Did you want to stop the share, or did you have anything else to share with us?
I think I'll leave it at that. I've sort of gone into everything there. Yep. All right. I will stop the share.
It looks so interesting, doesn't it? Love to get my hands in there and have a look myself.
It's good to do a self-assessment.
Yeah, I'd like to know, am I an Amber?
I know. We recommend that. Do a self-assessment, and it's interesting.
Very interesting, isn't it?
But having said that too, when we're doing these assessments, there are a lot of other considerations. It's not just sometimes sending the link to somebody to complete the assessment is not okay, not enough. So we do need to consider a patient's literacy, confidence, and their mental health status. So it could be that we need to ask that they come into the clinic a little bit earlier, and we go through that with them together, because it can be quite confronting, intimidating. You may get patients that feel insulted also.
Yes, look, we have that happen a couple of times where they feel a little bit insulted, like, why am I forced to undergo this? When someone is feeling under pressure and forced to do so, how would you communicate with that patient to make them feel comfortable and supported?
Yeah, look, it's not compulsory for the non-surgical space to actually conduct these assessments. It's a recommendation. So it's all in the delivery. I think looking at how you actually involve this within your own policies and procedures within each organisation. And it's the way you deliver it to your patients and your clients. So we tend to say, hey, we want to make sure that we're providing the best care for you. So this is an assessment tool as a pre-screening, and we will share the results with you so that you have an indication of, you know, whether you're screened to be an appropriate or perhaps not so much of an appropriate candidate for treatment today. It doesn't mean it's forever, it's for today. Yeah.
Right. Okay. Well, that's a really good way of saying it and putting it. We just want to make sure that we're practicing in a safe environment, that we consider your feelings and your personal situation as well.
Yeah.
And then put it on them like, you know, this is for you today. I love that. What else can we do to create a supportive environment for our patients, especially those with mental health challenges?
Yeah.
How do we
You
set?
could do you could do pre-screening questions. I mean, what we do in our clinics as well is that we'll have a set of like 5 questions. And the questions might be is, you know, when you look in the mirror, what concerns you the most? Now, the concern that you've identified, does that stop you from going to work or going to school? Does that concern actually do you look in the mirror multiple times a day about this concern that you have? If it's a no, 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 I may not proceed with the CANSAT tool. If I get some indication that there's something more and perhaps the patient, because, you know, intuition is it's still a very powerful tool. We need to trust our gut feeling. So if you get an answer that indicates that perhaps there may be a risk, I go straight into CANSAT. And I use the power of my prescribers to support me in rolling out that assessment.
No, I love that. I love the fact that you have the 5 questions as well. And they're very intuitive questions, aren't they? It's not just, you know, how do you feel about your wrinkle or how do you feel about, you know, whatever concerns you. It's deeper than that. It's, you know,
Yes,
how does that stop you from going to work? Does it stop you
functioning,
from functioning, or
ability to function.
does it cause you to feel, you know, any certain way about your own inner confidence? I think,
Absolutely.
yeah, I think, I mean, the ideal patient is the one that wants to continuously grow and improve and is really excited about treatment and is happy in general about it and feels quite positive towards it. A red flag would be what are we looking for in terms of a red flag?
With regards to patients and there's
The
multiple,
opposite of
the opposite of.
the opposite of someone's happy about having treatments and happy about, you know, how it's going to make them feel and positive about it. But there are also hidden ones, right? So you can
Well, I want to throw something in the mix here,
do
and
it.
here we are talking about our end users, which is our patients and our clients, and having a pre-screening tool for the purpose of litigation, for safe and best practice for us, making sure we've got the right candidate for treatment. That's all good and fine. But how do we actually manage the clinician and potential distortion with what beauty is and BDDE and depression and anxiety from that end?
I don't know. That's a
Correct.
good question.
So, you know, beauty's in the eye of the beholder. So if you've actually got a vulnerable patient coming in who is actually seeking treatments that potentially will distort them, but perhaps the clinician believes that that is beautiful and it's not a distortion, we've got a situation in our hands.
And
How do we manage
we've
that?
seen many situations. I mean, look, we have
And
access
it's
to
happened. And it's happened.
we've got access also to social media. We see trends that might not suit everyone. We see, you know, thank goodness the big lip trend is over. Big fat inflated lip trend is over because that doesn't suit everyone, right? Some people are born with naturally quite large lips, and you know, you're putting it on everybody perhaps doesn't suit. Maybe the aesthetic eye needs to play a part as well. But what does happen when a person comes in and thinks that that will look beautiful, but they actually don't need it? How do we approach, or we think, because you said it's in the eye of the beholder, so we as an aesthetic professional think, look, it might not be in the best interest of the patient? How do you deal with that when that happens?
Well, that's a really good question, but I think if we're going to take a universal approach to that question, then it takes us back to consultation and assessment. So what does beautification look like, and how do we measure beauty? How do we measure the thirds, verticals, horizontals? And that's where the education piece comes in. It's as simple as that. You've got great educators out there around harmonisation. Arthur Swift does it beautifully with fire and the calibers, and there's lots of training, opportunities out there. So I think that's a separate sort of discussion. If we've all been trained in how to assess universally, harmoniously and correctly, then we'll be able to identify what is aesthetically pleasing and what is not. It's about that harmony and the education around
I
that.
love that. It's
But
very interesting area. It's multifaceted. There's so many
it is.
considerations, isn't there, when you're dealing with
And then you've got the cultural. So that's another story as well. So we can talk about that harmonization, but there's lots of different cultures with different cultural perspectives of what's beautiful. So it's a forever evolving space and industry, but I think it all comes back to empowering our patients. So what we don't want to do is we need to identify a person's why they're seeking to have a treatment. Is it intrinsic? Is it extrinsic? Are they vulnerable? Are they happy to have treatment? If they're vulnerable, how are we going to empower them rather than make them dependent on a treatment, which can then lead to addiction?
Oh, I love that. Do you
Yeah.
think there's a real struggle in our industry, an addiction to what we do?
I think that addiction is real for most humans. Most humans have, an addiction of some description, whether it's, long-term, transient, short-term addiction is real. I think the changes that have come through from APRA and the TGA are positive because it's given people permission to stop, think, and it's created space. So it's been a good thing for consumers to a degree. I think it's been a great thing for clinicians as well. It's forced us to stop and think about how we practice and what that why is. We are going to have, and we will continue to have, vulnerable patients coming in to see us. So we have different groups of individuals coming in seeking treatment. You have the ones that are purely looking to slow down the aging process, and that's the name of the game, and that's what we're here to do. However, you do have individuals coming through who are unhappy, who have an unmet need, and our job then becomes a little bit more challenging because we need to find out what that unmet need is, and it may not necessarily be an aesthetic modification. It could be something different. So we need to be I suppose, faceted in our thinking and in our approach and in our ability to refer. And that's something I think we don't do well in our industry, and that is referral to an appropriate clinician.
I agree. We have so many incredible niche practitioners who are really experts in the field of what they deliver. And I do believe that referral is a very powerful tool if done correctly. And you can create your own circle of professionals that you trust as well. I get a lot of people saying, "Oh, I don't like to refer because I feel like I lose my patients and my clients to the people that I refer to." But you can refer in a safe way where you work together in collaboration for the benefit of your patient, to create a really holistic treatment plan. I think that's the best for your clients and patients. They have so many needs. Like today, I had a nutrition consultation tonight about anti-aging, and it was to do with what can I do with various supplementation and diet to, again, we're talking about slowing down the aging process. And I was referred to this wonderful person, and I got so many great tips and advice. But I think it's just disempowering when we don't use and utilize each other's skills, don't you think?
I do, and I think one of the challenges and barriers to that for us in our industry is the dollars and the cents. So if you think about mainstream care, medical treatment, you go to your doctor and he needs to investigate further or refer, he will happily refer you to, to a specialist for further investigation for the greater good, and that is you, your health and your well-being. So I think we need to do that better in our industry and not be roadblocked by the risk or the thought of the risk of losing money because we're going to refer a patient and they may not come back. If they don't come back, so be it. The name of the game is for the greater good, and to ensure we're empowering our patients and that they have the best outcomes that the outcomes that they're seeking and the best outcomes. And I think that's a little bit of a roadblock that we have.
Conversation is starting to change because, you go to so many conferences and you start going to conferences, it was 20 years ago when we started, and the conversations have shifted over time, have you noticed?
Yes.
And they've evolved. And, I started going to conferences where they didn't even consider holistic health or mental health. They didn't consider the holistic face. It was just, surgical improvements or non-surgical improvements in disconnection to the skin and the general well-being and health of the patient. Now it's a more holistic approach, and now we're talking about the mental health. So we thought holistic was, global face, rejuvenation. Then we talk, no, it's actually well-being. Global is actually now mental, not just physical well-being, it's now mental well-being. What's next? Where do you think the future of this industry is going? And in particular, where do you think the assessment of patients' mental health, well-being in the future of aesthetics is going to be?
Well, I'm really excited to know and to see the shift and the change happening. I work very closely with Dr. Agnes, who has the BioAlly, and she's all about intrinsic health. And I think that's a big consideration for us working in the aesthetic space. It's not just the outside, it's the intrinsic, health that we all know, if the gut health is not right, we're going to have skin disorders. If the gut health is not right, we're not going to be happy, and it can affect your mental health status. So I think we are very much shifting towards that, which then obliges us all to be better educated from a more holistic perspective when we're delivering care to our patients. So I think that's really exciting. I'm excited because I don't know enough about it, so that then means I've got to learn, which is great. From the mental health space, I think I'm not sure, it's all fairly new with what's happened, and it's set in concrete for the plastic surgeons with what they need to do with the pre-screening. I'm guessing there'd be close monitoring on the likes of complaints and the nature of the complaints that go through to APRA. And if they're persistently increasing, I wouldn't be surprised if it becomes something more mandatory in terms of the pre-screening for better management of patients seeking treatments. And that's just my guess. I don't know, but it's all about safety, and it's all, it could move there. I mean, the infrastructure's there. We're only a step away, really.
And that, we're talking about surgical, non-surgical health, but we're now moving into the beauty aesthetics side and space. Do you think there's room for beauty, so clinical beauty like dermal, to actually use mental health screening tools as well?
I think it's appropriate for absolutely everyone. And I think that until we revise the way we do our consultations and assessments and not treat them as a tick and flick so that we feel covered and protected and we've done all the right things, I think the risks are there. I'm quite passionate about the way we consult and assess. And I'm going to share one example as a take home tonight, which is, quite often we all ask the question of, have there been any medical changes since we've last seen you? Patient will say no. Are you seeing your doctor for anything? Common question. No. And you keep moving to the next question. But if we actually stop and say, okay, you're not seeing your doctor for anything, when was the last time you went to see your doctor? that's when we start to get things coming up. Oh, what was there actually last week? Oh, what were you there for last week? Or another then question would be, when is your next appointment to your doctor? So I suppose what I'm saying is that we need to learn to ask the same question 2 to 3 different ways to try and extract information, because we still have the risk in our space and in our industry where our end users, our patients and our clients don't respect the fact that these are medical treatments, invasive treatments, and they're not an extension of lipstick and makeup. And there are contraindications that, need to be considered. So I think we need to up the ante and change, I suppose, the way we do our consultation and assessment to raise the bar and make our patients aware, or our clients aware, that, this is serious business. I think I've lost you. I think we've lost Steph. We'll wait till she gets back on. But I might just open to say, feel free, if there's any questions, start rolling in the questions while we wait for Steph to come back. All right, so Steph's had a little bit of a malfunction. We want to thank you. Thank you for your time this evening. We hope we've shared some pearls that you can take back and apply to your practice and clinic. So on behalf of Steph and myself, good evening and thank you so much.